Hi viewers, I'm Dr. Ram here. So today's topic is cardiac cycle. I'm going to very simplify this. I'll try to make this very simple under 3 minutes, okay? Before we go, hit that like and subscribe button to get more videos from me like this, fine? Okay, so before I go to the four phases of the cardiac cycle, I want to make sure you know this two important points, okay? One is that I want to mention the chambers. Left atrium, I have mentioned this as one, and left ventricle, I have mentioned this as second chamber, and the aorta, that is the third chamber. One, two, and three chambers, and the interplay between the pressure and the volume is nothing but the cardiac cycle. Okay, so wherever the pressure goes high in that chamber, the valve can open or close. So what are the valves here is the mitral valve, and the aortic valve. The mitral valve is going to open down in this direction from left atrium to left ventricle, and then the aortic valve is going to move upward, opens upward from left ventricle into the aorta. So actually the whole concept of cardiac cycle is to move the blood from the left atrium, left ventricle, and into the aorta. Fine. So this four phases, let's go. Okay, so in this four phases, if you see the term as ISO, if you see the term like ISO means same volume, same volume, isovolumetric, same volume. Fine. That means both the valves are closed in that stage. Okay, the mitral valve and aortic valve both are closed. So isovolumetric contraction, or say isovolumetric relaxation. Let's see more about it. Okay, the first stage is isovolumetric contraction. What is happening here? The mitral valve is closed and the aortic valve is also closed. The mitral valve is closed, the aortic valve is also closed, and the left ventricle starts contracting. So the left ventricle starts contracting and both the valves are closed. So there is going to be no change in volume, only the pressure changes. So the left ventricle pressure starts slowly rising. Okay, this is the first stage. And the second stage is a systolic ejection phase. Remember, this left ventricle pressure is slowly increasing, and when it overcomes the pressure in the aorta, for example, here is one pressure, here is one pressure. So when this pressure goes high, this aortic valve opens. Okay, so just imagine the pressure arrow direction, like the pressure will be in this direction, the pressure will be in this direction. So this direction pressure will opens aortic valve and closes the mitral valve. Am I right? So when the second chamber pressure is more than the third chamber pressure, the ejection of the blood starts. That is called systolic ejection. Clear? And now after the blood is moving from 2 into the 3, so blood is moving into the aorta, the aortic pressure is slowly increasing. When the aortic pressure is slowly increasing, and at one point 3 overcomes the second chamber pressure, fine, so the aortic valve gets closed. When the 3, for example, put the pressure arrows in this direction. Okay, when the 3 pressure overcomes 2 pressure, okay, and the valve closes, and all, you already know that mitral valve is already closed. Now the aortic valve closes and the left ventricle starts relaxing. So what is happening here? Isovolumetric relaxation. The left ventricular pressure goes down. Okay, goes down. So now when the pressure goes down than that of left atrium, that the left atrial pressure is higher than the left ventricle, now the mitral valve opens, and blood is moving from the left atrium into the left ventricle. This is called the rapid filling phase. Okay, why it's called rapid means lot of blood moving from the left atrium to the left ventricle because of the bigger pressure gradient, and then the blood flows slowly. That is a slow filling phase. I did mention here one more point. First is the rapid filling phase, and then the slow filling phase, and then only the atria contracts to push the remaining blood from the left atrium into the left ventricle. Fine, that's it. This is the cardiac cycle. So the whole point is that just imagine where is the pressure is high, whether in the left ventricle is high or low. What is the pressure? It's a play between the pressure, okay, and this play between the pressure opens or closes the wall, and whole idea is that the blood should move from left atrium to the left ventricle and then into the aorta. There should not be no back leak. Fine. Please like and subscribe, and I will see you next video. Thank you so much and happy studying.